At the start of October, the World Health Organization lauded South Africa's response to the global COVID-19 pandemic, yet data concerning both the spread of the virus and the indirect consequences of the lockdown suggest that the severe restrictions imposed in South Africa and some of the strictest in the world were far from effective. Well, joining us now to discuss this further is Benjamin Smith. He is with the Department of Philosophy and is an associate professor in philosophy. Benjamin, good evening, and thank you so much for your time. And in fact, it's Benjamin Smart. Apologies for getting that wrong there. So let's get straight into it then. You believe that the lockdown, at least the harsh restrictions that have been implemented, have not necessarily been beneficial. Why?
Okay, so my team and I reviewed the evidence for the effectiveness of lockdown at slowing the spread of the pandemic. So we mapped the rate of the spread of the infection against the various different lockdown stages, in addition to the initial mitigation strategies. And what you would expect to see if the hard lockdown was effective would be 7 to 14 days after the implementation of that lockdown, a significant decrease in the rate of infections. And that just didn't happen. And if the hard lockdown was effective, you would expect to see rate of infections sharply increase once the restrictions were relaxed. And again, that didn't happen. What we saw as lockdown restrictions were relaxed, we were able to go outside again and enter levels 3 and levels 2. We actually saw the rate of daily infections decrease again. And so there's a definite missing evidence base for the effectiveness of that hard lockdown that we saw come into place on the 27th of March.
Sure. Is the data not a bit more complex than that? Because obviously, as these lockdowns, as some of the restrictions are being eased, although businesses are opening up in different ways, we were still under some severe restrictions, and there was still a level of fear that perhaps might not be there anymore.
Just to be clear, what we are suggesting is that the hard lockdown, the staying in your house, not able to leave except for essential services,
so
and that
level 5. Just to be clear, okay, Dr. Smart. Okay, level 5.
Level 5 lockdown is there's no evidence that is any more effective than the mitigation strategies that were initially imposed, and when they're adhered to the kind of restrictions that we have in place in levels 2 and levels 1. So I agree. If suddenly people start meeting in large groups, like we've seen recently, the young matric students having their rage concerts and so on, if you start having large groups of people coming together, then those are going to be super spreader events, and you're going to have a real problem. The lockdown that is ineffective is that level 5 strict hard lockdown. Mitigation strategies are absolutely necessary, and pretending we shouldn't be doing anything is really damaging for South Africa at the moment.
Sure. I'm interested to know, what are the indicators that you would be using to mark effectiveness, right? So I'm trying to go back to that period of just the initial lockdown, that level 5 that you're talking about. And often part of the messaging that would come from government is that what they also want to do is to try and buy time in order to ensure that our health infrastructure has the capability or the capacity to be able to accommodate an increasing number of people who contract COVID. So some of the supplies that we needed with PPE, etc., simply wasn't available in the country at the time. So is effectiveness also measured from that lens?
Well, if that rationale makes sense, insofar as you don't want your hospitals full of people before the hospitals can cope with those people being there. But it only makes sense if the measures actually work. And the hard lockdown simply, at least there's no evidence suggesting that it did work. There's a difference between suggesting that there's evidence that it didn't and saying that there's no evidence that it did. And as it stands, there was no reduction in the rate of new infections 7 to 14 days after the level 5 lockdown was implemented. And if it was effective, we would have seen that. So although ideally it would be wonderful to reduce the number of people coming into hospitals, level 5 lockdown just didn't achieve that. What achieved that was the mitigation strategies that were implemented prior to going into level 5. We were already banned from meeting in large groups. The government were wisely recommending social distancing where possible, hand washing, and so on. These basic mitigation strategies are effective. And the reason, or one of the reasons we're seeing a second wave now, is that these seem to be starting, at least, to be ignored.
So from your view then, what are the interventions that government should consider putting in place in order to manage or try and contain the spread of COVID-19 right now?
I think government's on the right track. You can see that they've now moved to a more localized version where they lock down regions. Nelson Mandela Bay, for example, is under a new lockdown. But that new lockdown isn't the kind of lockdown that we had at the end of March. It's a kind of lockdown that restricts large gatherings. The drinking issue, again, is a way of preventing accident emergency units from being overwhelmed. I think that the government are doing the right kind of thing to try and keep the economy going as much as possible, because damaging the economy damages our health services indirectly.
In terms of strategies, and you were speaking about not just what South Africa has done, but what has happened in the rest of the world, which have been some of the more effective strategies globally when it comes to fighting COVID-19, from a human behavior point of view?
I think you have to try your best to persuade people to stay indoors where possible and not to mingle with other people where possible. And you look across Europe and you see that they have implemented, they're going to a sort of second wave of lockdowns now, but initially there was a lockdown strategy, and that did work. But in Europe, the context is very different. South Africa is a country where poverty is much higher. There's a lot more high population density living, where a hard lockdown is less effective, because even when you try your absolute hardest, you're still going to come into contact with many people. You're living 10, 15 people under one roof sometimes. It's just, you need to tailor your lockdown strategy for your context. And it might well be the case that harder lockdown worked in Italy or the UK, but Italy and the UK are living under different contextual conditions than those living in townships and informal settlements and so on in the South African context. And actually, if you look in South Africa now, what you see, I don't have data for the whole country, but in the Western Cape at least, you see that this second wave that we're viewing now is predominantly in the suburban areas where they were able to lock down properly. The second wave in the township areas, Khayelitsha, for example, is far less pronounced. And that could well be because of a larger exposure during the initial wave.
All right, Dr. Benjamin Smart from the University of Johannesburg. Let's leave it there for tonight. Thank you so much for your time on News at Prime.